gentlemen, it's time for us to officially welcome you all and give a brief introduction on what we are going to involve right here now onwards. Put your hands together and welcome the chairman of Medicare Organizing Committee, Dr. Amal Hazard de Silva, who is serving as the president of Asia Wellness Forum. Please, sir.
Dr. Ruan Senathilaka, he is our chairman of Private Hospitals and Nursing Home Association of Sri Lanka. He is Ruan, yeah, right, okay. And then Dr. Harun from India, and then also all the delegates who have come from India, our dear friends, and all the people who are coming from the Sri Lankan health sector, who are stalwarts in the health sector. And this gives me great pleasure in putting our own family together. I call it family from India because India has been helping Sri Lanka a lot. And I think when we come to India, we are like, our own families. Whenever there is a problem, we always talk to India when we are in the government or when we are in the private sector. And therefore, it's like a reunion of families which is coming here. And therefore, we would like to see what exact segments that you would like to collaborate further to enhance the health sector of Sri Lanka. Because some time ago, I can remember when we were not doing bypass surgeries in Sri Lanka. And we went all plane loads after plane loads to India, and then Indians were helping us a lot in Chennai, Apollo Hospital and all sorts of hospitals. And then the doctors thought, hey, why should we get plane loads to India? Let's go and train Sri Lankan doctors how to do bypass operations and angiograms and all that. I can remember about 30 years ago, Dr. Matthew Kalrikkal from Kerala, he came here and he trained our doctors. And now they are masters at doing angiograms and all that, and they also teach sessions in France as well. There are a lot of interconnections in the medical field. Therefore, likewise, there are many things which have come our way thanks to India, thanks to Indian hospitals. Now in the meantime, there are many things that we don't do it in Sri Lanka also. There are many of our clients who take the next flight and go to Singapore, go to Australia, go to UK and also go to America sometimes, apart from India, majority goes to India. And then, there are a lot of gaps in the Sri Lankan health system, especially high cost individual interventions, whether it's aesthetic care, whether it's sports injuries, whether it's IVF care. IVF care is in plenty. A lot of people go to India and now Indian hospitals are coming here. Therefore, we have reduced the traffic that way, but they are getting benefited of the Indian hospitals treating patients in Sri Lanka. Therefore, when it comes to India, our cultures are similar. Therefore, we can always relate to patients, relate to Indians very well. And, they are like at home when they discuss about their problems. Especially when patients come to us, they don't come to us just to see our faces. They come with the idea of getting some help. I think you have the potential of enhancing the Sri Lankan health sector in a big way and also help not only Sri Lankans but our neighboring countries in the region. Now when it comes to Bangladesh, I think there are geopolitical issues. Now they would like to come to Sri Lanka, and Indian doctors like to come to Sri Lanka. Pakistanis want to come to Sri Lanka. Then Sri Lankans living abroad, about 1.7 million people living abroad in Sri Lankans and doing very well. They can afford anything in the world. They can come back to Sri Lanka to get their medical needs done. Now when it comes to say cataract surgeries and all that, we do it very cheap here. But when it comes to UK, central London or downtown New York, it's about 100 times the cost. But we use the same Alcon machine, same Alcon lens, and the surgeon who is putting the lens is also equally qualified, whether it's downtown New York or downtown central London. Therefore, I think we have a competitive advantage in Sri Lanka and India especially, because you have handled mass numbers of patients in your countries. Therefore, we can learn from you as to how we can give our services to the grassroots levels. Therefore, these are very special things that we want to establish. And I spoke to the minister today, and minister also was very keen in getting Indian hospitals in trying to do health tourism in Sri Lanka. Therefore, he was specifically telling me to meet him after the budget, the 6th budget is over in Sri Lanka, for me to meet with the proposal as to how we can improve the working arrangements between India and Sri Lanka, and to also to improve the health tourism aspect of Sri Lanka with the Indian assistance, with the Indian help. Okay, assistance in the sense it's a business assistance. You will win, we will win, and also the patient will win. It's a win-win-win all round. That's the thing that we would like to see. And then I would like to get the ideas coming from this meeting with the Honorable Minister, and then see how we can take the idea forward. Once again, I will welcome all the Indian hospitals who have done a great assistance to Sri Lanka, and then also the Sri Lankan hospitals who have been working in Sri Lanka for a long time, and then also everybody who participate in this. Thank you so much.